This is going to be a really niche video, so if you're not into medicine or pathology, just keep swiping. As some of you know, I aspire to be a urologist, and I want to talk about the relationship between androgens and prostate cancer. This relationship is extremely interesting and not as straightforward as you'd think. It can get confusing because the androgen metabolite DHT is responsible for the benign nodular growth that we see in benign prostatic hyperplasia. Now, many would expect that due to this relationship that androgens would also drive the growth of prostate cancer, and that's half true. Now remember, androgens are basically masculinizing hormones, right? And prostate cancer cells are rich in androgen receptors and respond to hormone-mediated signals that regulate their growth. There has been evidence of this for decades, as males who are castrated before puberty have virtually no chance of developing prostate cancer later on in life. Remember, castration is basically removal of the male gonads or testes, and the testes are heavily involved in the male production of androgens, like testosterone. At least half of all prostate cancers are positive for a particular gene rearrangement that takes a member of this ETS family. Okay, these are basically a family of different oncogenes that will encourage growth of the prostate. And what it will do is it will rearrange and juxtapose it right next to this gene called TMPRSS2. This is an androgen active promoter, so that whenever the prostate cells are in the presence of androgens, they will upregulate both the production of normal TMPRSS2 associated genes, as well as the ETS family of oncogenes. This forms the basis of the rationale for the use of different anti-androgen medications for the treatment of prostate cancer. Examples include the use of flutamide, leuprolide, which is actually a GnRH analog, which has downstream effects of suppressing androgen production, and more recently, enzalutamide. Unfortunately, for reasons that aren't entirely understood yet, prostate cancer can eventually grow to become resistant to these anti-androgen therapies. Some hypothesize that it's due to the increased acquisition of other mutations that might be driving the oncogenesis of prostate cancer. Others hypothesize that it could be due to prostate cancers acquiring a resistance to chronically low androgen levels. However, androgen levels that are simply high aren't associated with prostate cancer either. The relationship is more complicated than just low or high androgens. As a matter of fact, even diets high in saturated fats have been implicated in increased incidence of prostate cancer, and some hypothesize that that's why it's so common here in America. There's so much more to talk about, and this is just so complicated, but I think that's why it's so much fun.